Nasogastric therapy. By inserting a nasogastric tube, you are gaining access to the stomach and its contents. This enables you to drain gastric contents, decompress the stomach, obtain a specimen of the gastric contents, or introduce a passage into the GI tract. This will allow you to treat gastric immobility and bowel obstructions, and also for diagnostic purposes and therapeutic purposes. I am NGT. Today I'm going to demonstrate nasogastric therapy. Before that, you must know the patient's data, the name, birthday, address, status, and vital sign. And also, you must read the doctor's order, the patient's condition, and the doctor's diagnosis to the patient. Now, first, you must go to the room, knock to the doors. Then, as if you're inside in the room, greet and introduce yourself to the patient. So, good morning, ma'am. I am Edwin J. Karanang, your caregiver from 7 to 3 p.m. So you are Pipay Sanchez, 24 years old. So, ma'am, you're from Santiago. And ma'am, today we're doing a nasogastric therapy. So, I'm gonna insert NGT NGT tube in your nose. Is it okay? Before that, you want to micturate or defecate. And if not, you must prepare the equipment. Prepare equipment. After preparing equipment, do the hand washing. Then, as if I'm done with the hand washing, so put on the gloves. Then, after that, you must go to the patient's room, ask the permission to, is it okay, ma'am, to do the operation right now? And if it is yes, then provide safety, dignity to the patient, and privacy. So, first, put the towel in her chest, and mom's Pipay's chest to avoid missing with the bed. We have the NGT tube. Measure from nose to ear and from ear to the stomach. So the mark is right here. Lubricate the tip of the tube from 2 inches to 3 inches. So, assuming that this is a KY jelly, water-based lubricant, so put it right here. Then lubricate the tube. Before insertion, using a flashlight, check the nose of your patient. Please close your eyes, ma'am, to see if there's a scar or anything that can harm your patient while inserting the tube. Then, ma'am, I'm going to insert the tube. Kindly breathe with your mouth, right? And if you feel that the tube is in your throat, please kindly swallow. Swallow, right? That's right. Then after that, lock the tube. Put it behind the pillow. And use plaster to maintain the tube's placement. from nose to now, to make sure that the tube is in the stomach, you must check the placement of the tube. Now, we're gonna need stethoscope and a septo syringe. So, put a septo syringe in the tube. That's right. Then put the stethoscope in the stomach. Introduce air. Hear a gurgling sound. If you hear that gurgling sound, that means that the tube is in the stomach. Okay. Another procedure in checking the placement of the tube is the gastric content. The gastric content will rise up to there and then lock the NGT tube. Then the gastric content will something here and test it to the litmus paper. Now, the color of the gastric content might be greenish or orangey. And if you put the gastric content in the litmus paper, it will turn red, and that indicates that it is good. Another procedure in checking the placement of the tube is a glass of water and submerge the tip of the tube or the tube into glass of water and see if there's a bubble, and if there is no bubble, that is good, but if there is a bubble, that indicates that the tube is in the lung, and notify the doctors quickly. So there is no bubble. Lock the tube and put it behind the pillow. So we're done with the insertion and or the lavage. After that, all the procedure document the you must document the vital signs before and after. Also the reaction of the patient before and after. Time and date. That's all. Now we're doing the gavage or the feeding. First, you must again go to the patient's room, knock, and assuming that we're inside, so you must greet the patient. Good morning, ma'am, or good afternoon, ma'am. I am your caregiver from 73. I am NGT. We're going to feed you your insure. So again, check the placement of the tube. Now, to make sure that the tube is in the stomach, you must check the placement of the tube. We're gonna need stethoscope, a septo syringe. Put a septo syringe in the tube. That's right. Put the stethoscope in the stomach. introduce air. Hear a gurgling sound. If you hear that gurgling sound, that means that the tube is in the stomach. Another procedure in checking the placement of the tube is the gastric content. Test it to the litmus paper. It will turn red and that indicates that it is good. Another procedure in checking the placement of the tube is a glass of water and submerge the tip of the tube and see if there's a bubble, and if there is no bubble, that is good, but if there is a bubble, that indicates that the tube is in the lung, and notify the doctors quickly. So there is no bubble, lock the tube and put it behind the pillow. Now, put the towel in the chest. Avoid messing with the bed as well as the patient. Prepare the insure, assuming that I've already prepared it. So there is the insure and water, and of course the medication. If the doctors have a medication for the patient, you must follow it. Put the acetylene syringe to the tube. Make sure that you always lock the tube to avoid unnecessary or unwanted air to go inside the tube. So, remove the valve. So, in the doctor's order, the insure is 20 ml. So, assuming that this is 20 ml, so we're going to put it right here and let it flow. After that, you're going to put some 30 ml water for flushing. And then the medication, the 30 ml medication for the patient. And after that, again the water for flushing. Lock the tube, remove the acetylene syringe. Put it behind the pillow. Now remove the towel. And then let the patient relax 1 to 2 hours. Don't forget to document what you have done, the vital signs, the mLs of insure and water, and also the reaction of the patient, and of course the time and date. Assuming that it is 1 or 2 hours later, go to the patient's room, knock on the door. Assuming that you're inside, greet the patient. Good evening, ma'am. I am Edwin Chiquiano, your caregiving from 73. Today, right now, ma'am, we're going to be doing graffiti drainage. Is it okay for you, ma'am? So, you must ask the patient's approval. Then, put the towel in her chest. Again, to avoid messing with the bed as well as the patient. So, now, to make sure that the tube is in the stomach, you must check the placement of the tube. We're gonna need stethoscope, a septo syringe. Put a septo syringe in the tube. That's right. Put the stethoscope in the stomach. Introduce air. hear a gurgling sound. If you hear that gurgling sound, that means that the tube is in the stomach. Another procedure in checking the placement of the tube is the gastric content. Test it to the litmus paper. It will turn red and that indicates that it is good. Another procedure in checking the placement of the tube is a glass of water and submerge the tip of the tube and see if there's a bubble, and if there is no bubble, that is good, but if there is a bubble, that indicates that the tube is in the lung, and notify the doctors quickly. So there is no bubble, lock the tube and put it behind the pillow. Put a safety syringe introduce some water, 60 ml. Now pump the water, then some of the gastric contents will rise up here. Then lock. Then put the gastric contents in the kidney basin. Do that again until the gastric content is clear. Again water, 60 ml. Pump it. Then flip or lock the tube. Put it right here, the gastric contents in the kidney basin. And after that, lock the tube, put it behind the pillow, and wipe some wet cotton in the patient's lips. Now, we'll be doing the removal. So, when you're doing the removal, tell the patients to hold her breath while you're pulling quickly the tube. So, but before that, remove the plaster carefully. And tell the patients to hold her breath in a count of 3. Mom, can you hold your breath? And 1, 2, 3. Quickly dispose the tube. And then wipe the wet cotton to the patient's face. In the nose as well as the lips. And then check the nose if there's a damage. If not, that is good. Fold the towel. And then document the vital signs, the mLs of water, document the gastric content color, time and date, and the reaction of the patients. Now we're done doing the nasogastric therapy. So lastly you're gonna do is to clean up the equipment in the room. And that's all. Thank you.